Hi, wonderful community. Welcome back to my channel. Today we'll be talking about breast cancer. As you can see, I'm on pink. It's the pink month, pink a thorn. So you must have seen every medical person on pink. Everyone talking about the pink ribbon, everybody talking about breast cancer, trying to tell people about breast cancer. Yes, this is breast cancer month, and that is one thing on every medical person's mouth. And today I would like to tell us about breast cancer. If you've not subscribed to this channel, please do so. I share medical advice and I also talk about how to study to pass your exams and then a little bit of motivation. Welcome. So before I start, let's listen to this story I saw online and I want to share it with you. So listen, okay? I'm reading the story right now. She walked into my office that morning with a swollen left hand. She tried to smile, but I could see pain behind her eyes. I asked gently what happened, and she began to speak. She said months ago, she had felt a hard lump in her breast. She didn't waste time. She went straight to the hospital. They did a scan, then a biopsy. When the results came back, it was malignant, that is breast cancer. The doctor advised her to do a mastectomy, remove the breast early before it spreads. But she said she couldn't. She was only 25. Too young, too scared. She cried and left. Then a friend told her about another clinic that gives drugs for breast cancer. No surgery, just medicine. She believed them and she started taking the drugs. She went to the place and started taking the drugs. Weeks later, the breast became harder and then one morning her hand began to swell. That was the day she came to me, the writer. So when she sat in front of me, I could see fear and pain. As I examined her, I froze for a second. Her breast had a typical peeled orange look, the skin thick, dimpled, and slightly warm. My heart sank. I knew what it meant, but I also knew I had to stay strong for her. So I held her hand and we talked, woman to woman. I explained what was happening, what we could still do, and how early treatment might help. I referred her immediately to an oncologist, and for a while, she started treatment. She was fighting, she was strong. But months later, when I called to check, the oncologist said she had stopped coming. Not because she didn't want to leave, but because she couldn't afford the treatment. She's a young lady trying to survive, and this illness came on her like a storm. I sat quietly that day and I cried. I didn't blame her for refusing mastectomy at first. At 25, it is not easy to imagine losing your breast. But my heart aches because sometimes in saving our beauty, we unknowingly lose our lives. Doctors don't remove breast because they want to. They do it because they are trying to save your life. Your breast is beautiful, yes, but your life is more beautiful. Please, my sisters, check your breasts, do your scans, follow your doctor's advice. Don't let fear or shame delay your healing. What a touching story. You know, when I read this story online, it touched my heart that I decided to share it across my social media handle. Like, I felt so bad for this young lady. Like, imagine losing your breast at 25. We've been told that breast cancer occurs from 40 upwards, but this is a young lady of 25 battling with breast cancer, aggressive breast cancer. So it can be anybody. So today let's talk about breast cancer. Okay, breast cancer is just a mass, kind of when the cells of the breast starts growing without being controlled. They form mass and this mass eventually keeps growing and eventually moves around the body, like metastasizes around the body. That is breast cancer. Who is at risk of this breast cancer? Women that are 40 and above, This does not mean that it can't happen to younger women that are in their 20s, but it is rare. As long as you are a lady, you should be examining your breasts. But then we generally 90% of breast cancer happens after 40 years of age. That does not mean it wouldn't happen to younger women. Then if you have a family history of breast cancer, there is an increased risk of you having it when you get older. So you have to always check. If you have a family member with breast cancer, that should make you to always check your breast, always go for routine examination. Okay, then early menstruation and late menopause. The more the body is exposed to estrogen, the more the person is prone to having breast cancer. How? If you started menstruating early or your menopause came late, you see your body is constantly exposed to estrogen. Then we have obesity and alcohol use. This smoking and alcohol intake and obesity can actually be a risk factor for cancer. Then hormonal therapy use. Some persons abuse postinol. Some persons abuse combined oral contraceptive. Abuse of hormonal therapy can also cause breast cancer. So before you take any hormonal therapy, make sure your doctor knows about that. Then the next thing I would like to teach us is how to do breast examination. We talk about the fact that early detection is still the key to treatment and management of breast cancer. So that is why we teach the younger women how to do breast examination. Let's go. So the first thing to do is to stand in front of the mirror and look at your breast. Okay, check for any skin change, check for color change, then use the parts of your hand and then check for lump, check for if there's anything, if there's any abnormality. However, it is always good to do this test 5 to 6 days after menstruation. That's the ideal days you should do this test. So you feel for lump. You can start from, the breast is divided into 4 quadrants. We have the upper lateral, upper medial, lower lateral, lower medial. So you move like that and then come to the middle and then okay. So you just have to do it well so that you can be able to get everything. Okay, so move, check everything. When you see something that is abnormal in your breast, what are you looking at for? Check for discharge, check for lump, check for color change, check for look at your nipple. Is it inverted? Make sure you know your body so that when you see something that is outside what you used to see before, you will be able to pin it down. Oh, this is not right, this is not how my body is. Okay, and then if you are up to 40, go for a mammogram every year. Okay, then you can also go to the doctor for a routine breast examination if you don't know how to do the normal home breast examination, especially if you have a family member with breast cancer. Then the next thing I would like to talk about is how we manage breast cancer. This depends on the presentation and depends on your doctor. So we have different management procedure. We have mastectomy. This is usually done when this breast cancer is detected early. Of course, cancer cells are from the breast, so when you take away the breast, you are taking away the cells, and the cancer only develop when there is breast. So most times we just remove that source of cancer, especially when it's still within the breast. So doctors tend to take out the breast and then the person is cancer free. Then we have chemotherapy and we have radiotherapy. Then hormonal therapy. Sometimes they do surgery and then they do give chemotherapy. Sometimes they give chemotherapy, surgery, and then chemotherapy. Sometimes they do radiotherapy, depending on the one that your surgeon prescribed for you. That should be the one you will do. Okay, because my information is just for knowledge and it shouldn't be above whatever your doctor is telling you. How to prevent breast cancer? The first thing is maintain healthy weight, limit alcohol and processed foods, stay physically active, go for breast examination and routine checks. and it will help. Okay, let's fight against breast cancer together. It is something that we can actually fight together. I feel so happy when a patient walks into my office and the first thing the patient will tell me, "Good morning, doctor." I will just greet the person, and then the next thing the person will be like, "I'm a cancer survivor. I survived breast cancer, so I just want to check myself." I'll be like, "Wow, this is beautiful." So while breast cancer is killing a lot of persons, some persons still survive breast cancer. Early detection still remains the key. Bye.